My name is Percy Crunchy. I'm 52 years old, and I've been living with HIV for 32 years now.
I discovered I have it on 2014 thereabout.
I had HIV about 50 years ago.
The nurse came to the ward and asked and told me that I have that sickness.
Perhaps next to death, it is the most shocking piece of news that the majority of people will ever hear.
At the house, I don't communicate with friends. I just be at the house alone. And then praying that whatever that is, but I'm infected. If I have it, I will die. If I don't have it too, I will die.
For that moment, she told me, I felt sad, depressed, even thinking of going to kill myself.
I
prepared my own concoction. I took it. Yes, I did. I did take it. Just want to leave this world and be free.
Indeed, thousands have died from it, alongside dreams, hopes, and aspirations.
My woman expired.
In fact, both of them passed that. I lost both of them.
Yet, many more have survived it, battling each day and leading others in a constant war to cling on to their life and health.
I thought I would have died by now. By now, I'm 31 years now.
I was 32. I think that I would die, but now I'm 41 years.
This is a catalogue of stories of pain, regret, but also resilience, hope, and dedication. Ghana's HIV AIDS journey thus far. The fight against this global epidemic enters the 5th decade. There have been several strategies adapted over the years to win. Whilst there are many successes chalked, challenges persist. In Ghana, about 346,120 people are living with HIV, and 66% of this population are females.
I don't know how I get it, so I don't think about it.
Alice Wichana is a mother of 2, expecting her 3rd child. She has lived with HIV for more than 15 years. Alice only found out when she submitted herself for testing, a random one. She was in junior high school at the time.
I discovered I have it on 2014 thereabout. I sent myself to hospital for a checkup because I hear that there are HIV virus. So I sent myself to do checkup whether I have HIV or not.
Alice looks strong, not just physically, but also emotionally and mentally. But that has always not been the case.
By the time I realized that I have this condition, that time there were no drugs. We only used Septrin before the drugs came. When the drugs came, I started taking the drugs. Then I was feel better than before that. The time I wasn't taking the drugs.
The concern about having more females testing positive for HIV stems from the possible mother-to-baby transmission, a key part of this fight. The Director General of the AIDS Commission throws more light on this.
There are challenges with prevention of mother-to-child transmission. The challenge is not the uptake of the services. The challenge is systemic. They use PCR tests, and we don't have adequate PCR equipment in the country. We have them in the teaching hospitals and regional hospitals. And so places where these equipments are not in use, they have to transport the samples they collect to where these equipments are. And then the results are also transported back. And this arrangement is not working to best effect.
Many mothers have unknowingly affected their children because they failed to test or avail themselves for treatment. These innocent children are often subjected to a life of dejection and misery. That is the story of Nyameche, as we choose to call him for this documentary. He was often sick and suffered many complications.
Running by almost 1 year. Namoko, some pastor in kitchen area, more bomber. Like medicine around 5 months to 6 months, but still not running, and I'm run.
Nyameche's mother died when he was just a little boy. It is said that her mother exhibited similar symptoms, which doctors now believe was HIV. But this conclusion was only reached after Nyameche, in a rather dramatic but depressing tale, learnt of his status.
Okay, around more it's a number like starting from the Musun or kitchen day. In the Musun. Like this sound that my mother when I'm in kitchen and my mother is like more class 2 now. If you know this sound about hours no yet. I'm a come away in nothing on no means like so it's like I'm being also other women.
At this point, it was almost as if his life had come to an end. He felt the curtains drawing down on him. But then comes a helper who handed him a lifeline. President of the Eko Ewusi Foundation, Horace Eko Ewusi.
Nyameche's case is a little bit unique in the sense that his condition is permanent, so we had to adopt him and not only help him medically, but try to let him go back to school, which he is now. He's now back to school. Help him to live his normal life as much as possible.
In the central region, there's a deliberate effort to collaborate with traditional leaders, especially queen mothers, to achieve the set goals.
We are engaging the queen mothers especially because we don't want to have a situation where we keep on recording new HIV infection among the infants. We are going to engage them. Yes. We have this plan to engage them. We are going to re-engineer whatever they have done before.
Those days, PMTCC services have low patronage due to fear and stigmatization. Yeah. So those days it was voluntary, it was mandatory. So the answer is we are doing HIV tests in this room. So if you are done with us and you want to do it, you can go there and do it.
That is Faustina Okanse, a 46-year-old woman who is now an advocate for NGO Mothers to Mothers, an HIV AIDS focused organization. Her intuition during her second pregnancy drove her to test for HIV, even though she thought she had no reason to do so.
Per my knowledge, I know a married woman or a married person cannot get HIV, so I didn't go to test. It was after I gave birth before the child started to get sick before we go to the hospital, and then he has been diagnosed HIV positive.
Life after this will be unbearable. She'd lose her husband, her baby, her business, her social life, and in fact, nearly lost her sanity.
I have faced high level of stigma in my area because after the death of my child and my husband, rumors about my HIV status started spreading all around my community. By then, I have a small food shop and people stopped buying from me, believing I will infect them through the food I cook. So I have to stop. and now I lost my source of income. You know, I lost my husband, and that is the only thing I have to take care of the other 5 kids and myself. Now I lost that one too. So life has been tough. In fact, I suffered a lot. I suffered stigma a lot. To the extent that all my children has to be sacked from school to come and be in the house.
The stigma she suffered was enough to send her to an early grave. But she found hope in her children and chose to live for them. Today, she works happily, encouraging scores of people who are faced with the harsh reality of living with a virus.
You see somebody crying, the nurses will do their best trying to encourage the person. This person will still say, no, I'm not accepting this, I have to go and kill myself. I cannot say, no, my friend, look at me. I've been on treatment for these years and I'm still alive. Say, wow, are you sure you are not lying? Say, it's true. And they ask so many questions for them to be able to know that what you are saying is true. And finally, they accept their status and then they will be on treatment. So that thing motivates me more, that although I'm HIV positive, which I was not expecting, through that I'm able to save other people's life.
So for Alice, the antiretroviral drugs were the best thing to have happened to her. All her children are HIV negative.
I was very happy because I don't want to have condition while my child is on that condition again. And like I was also thinking by this time I would have also died. I wouldn't have gotten my first child, I won't get second, rather than talking about it.
The prevalence rate of 0.83 in the Upper West region is the highest among the 5 regions of the North. The Director General of the Ghana AIDS Commission explains what factors may be driving the new infections.
The regions that have high prevalence in the country, when you look at those regions, you see that 1, the sex worker population is high. Same as MSM population, men who have sex with men. Drug users, it's very high in those places. And whenever you see, and the places where you see change in the epidemic from low prevalence to high prevalence, like Upper West region, like Upper East region, you see that there is movement of sex workers. There is movement of long distance truck drivers. There is also transactional sex. So these are the characteristics of places with high prevalence.
Meet Osman. He's 77 years old and has been HIV positive for the past 15 years. He's quite popular in the Wa municipality and responds to the sobriquet, "Baby Don't Go." He admits he lived quite a loose life until he started falling sick. It was too often and quite complicated.
I was falling sick up and on with different complaints. Tomorrow my chest, the following day my diarrhea. I even have some rashes on my chest and my stomach some time ago. And then I get to, and I've been to so many, about 4 hospitals in the region. But anytime I get to them, they only treat the complaint that I brought. But it was still on and off. Until one day a friend of mine, or a foreigner from Canada, came and saw me and advised me to go to the hospital.
At this point, he contemplated suicide.
I felt sad, depressed. I've been thinking of going to kill myself. Because one, I'm one of the leading elders in my community. And if you talk of town property, I'm a bit. At least if I counted 4, I will be among the 4 people in my community. So I thought of all this and I said, If I get there, then I better go and kill myself and rest.
Breaking the news to his wife was the next hurdle. He thought the situation could break the marriage, but the Canadian friend made it easier.
Before the woman left, she told her, but she didn't tell her that way, but she told her that whatever I tells her, she should not be worried about it. Even if she also get the same. If it doesn't get through, but since we have the love and we have children, at least, the divorcing me, or the divorce, it will bring a really big problem. And so I said, if anything, she should come and also test. So she came and tested, and she was negative. And yet we are still together.
He was now on medication and stuck to the prescription faithfully, observing the hours and the frequency. After a few months, he had changed his mind. His fears about the shame and stigma began to fizzle. Osman decided to let the cat out of the bag. And this will be the turning point for the retired teacher.
After taking those medicines and for the past 4 or 5 months, up to 6 months, then I thought, well, I'm not all right. If I hide, I'll kill other people. Why can't I come out to save lives?
So he's now an apostle of HIV, preaching against stigma and leveraging on his popularity in the region to create awareness.
Almost all the FM stations in town here knows me. Almost all. I've gone to most of them. I've gone to almost all the FM stations. Not me alone, either with the social welfare officer, or the data officer, or a town chef. Some of them invite me.
Stigma has been the Waterloo in this campaign, driving many patients to do the unthinkable, all in the bid to get rid of the virus and break the shackles of shame that has entangled them. That is why many seek answers from traditional, religious, or spiritual sources. Lucy is one of them. She narrates her ordeal.
The pastor told me that I should bring 400 Ghana cedis. I don't have the 400 Ghana cedis, and one of my brothers gave me the 400 Ghana cedis. Every blessed day, go and come. 10 cedis, the Lord fair, all make 5 million. And he told me that I should fast again. 7 days.
In the 9 years of living with the virus, this was her lowest moment. She nearly lost her life. Lucy has vowed never to default on her drugs and is now wary of such religious or traditional outlets that claim to have the cure to HIV.
Cut my skin. I defaulted about 3 months. I haven't taken the drug again. So look at now, I defaulted about 3 months and I came back for the medicine again. Now look at how I'm eating. Yes, now I'm healthy, I can eat. But at first I cannot eat.
She's not the only one who has traveled this path. From Wa, we came to Kumasi to meet Percy Crunchy, who was also falling victim to the cunningness of self-styled pastors who claim to have the cure for the virus.
I was listening to my radio around 4:30 a.m. And there was a pastor in Kumasi here saying that he has a cure. He will pray for you and you'll be okay. So it touched me and I called him and he told me to come. So that time my brother, one of my friends in US, have sent me about 1,000 Ghana cedi with me. So I just took the money and then came to him. He sold, it was Frito. I saw really that because if I taste the oil, I see that it's Frito. So the next day I started taking it and it was not giving me any response. And I was deteriorating. So I just said that if so, I'll try and cook egg with the oil and see whether it's a real anointing oil. Then I fried egg with it and it was okay. So I came to see that it was just a Frito.
Percy is one of the about 80,000 persons living with HIV in the Ashanti region per the 2019 report. Regional Technical Coordinator Olivia Graham gives us a breakdown of the figures. She indicates a marginal reduction in the rate of new infections.
2019, the figures that came out, that is the estimates and projections that Ghana Aids Commission brings out. We saw that Ashanti region, we had about 4,500 new infection. That's around that figure. And then for the 2020 figures, we saw 3,590. So a slight decrease there. And even the national figures too, there was a slight decrease.
Regardless of the progress, stigma remains a big challenge. Percy Crunchy, who is now an advocate, says many still believe that persons living with HIV are simply promiscuous in nature. But no, listen to his rather painful and perhaps the most unlikely circumstance that anyone could contract the virus.
When I was young, I was very, very stubborn. I don't forgive whoever tempts me. I want to try my best that I'll always defeat anybody who comes across me. So I had a fight with a guy and he bites me in my hand. So he had a cut in the mouth and I had a cut here. So the blood came into my hand. So when we were sent to the hospital, the doctor said that the guy is positive. So automatically, at that time, there was no drugs. So he told me that before some time, I'll become positive. So when I go to the hospital and they diagnose me of any positive disease, I should accept it because I've already contracted the virus.
He fought to protect his family and property, but now marked to fight for his life forever. So far, Percy appears to be winning. He looks healthy and has allowed his life to be the springboard from which many lives have been lifted. His advocacy knows no boundaries, from bus terminals to marketplaces, churches, and anywhere he gets the opportunity.
For my message, if I may not lie, any place, if even I'm in a car traveling, when I meet 2 or 3 people, even Kumasi here, I'm also a photographer, a cameraman, a video man. When I go to the studios, I go there, educate them.
If you found Percy's story sad and strange, then hold on. This one will change your mind completely. The mystery surrounding how a strong, hardworking, prayerful, and faithful wife will contract HIV is yet to be unraveled.
The doctor asks, do you have multiple partners? Have you had blood transfusion? All those things. But it was the blood of course, no multiple partners. And the blood transfusion, I had one in 1995. So that was where I said, yes, that could have been, I was infected. And I got that blood transfusion at Kolebu Teaching Hospital. So I was just wondering, so what was wrong with them at that time that they couldn't test the blood properly? But I just left it at that. But then, if that is it, even before I thought about it, if I could be infected, then I'm sure anybody else can, or if it's that easy to be infected, then I'm sure anybody else also can be infected.
Elsie Aye is the national president of persons living with HIV. She's been living with the virus herself for 18 years. One day,
when I went to take my bath and I poured water on myself, it was black water just flowing out. I looked at my skin, it was still there. My skin had turned black anyway, it was dark, far darker. But it was still my skin. But then black water, and I said, no, this was, it now beats everything. So I decided I needed to go for some tests because nobody told me to go for any test. So I decided I'll do an HIV test first. Then I'll do hepatitis B. And then after those ones, then I'll come and find out which other tests to go for.
She was hit by the news, confused and stunned. Getting her husband and the children along was the next hurdle.
I told them according to age. When you finish your university education, then I tell you. And I think they were close at that time to finishing. So I told them one after the other.
Elsie, now more than ever, lives healthy and has gotten everyone along. But yes, there are stories of promiscuity that lent itself to the belief and the associated stigma which comes with HIV. Dinah Babire's husband transmitted the virus to her. She was pained when she found out and thought this could have been avoided.
Na my dream na say about typhoid. They na esitie ni ntino. Ntiema me nso me ya dream say sanity na ko ye hwemu. Nti me koye no, nti say we ni ko pie mu. Nti ye me ye o me mu yie pa.
But she would then turn the situation around and begin an NGO that will educate, create awareness, and help fight against the wild spread of HIV in the 2000s.
Sane mi sitie na me dwene say yare no betimi aba me side na yare na aba no sane me nua bi nso esusu fi se na time bia me dwene say obi a watu kwan obi a ommo ne bra yie ono na onya yare ewe na me nso a me ntesa no de na se me mani pa hu say ade no ho tin frasese me bo hu dawuro mani pa hu say yare no ewo ho.
The latest figures in the new infections for the first half of 2022 show a significant 320,000 persons infected. Olivia Graham says her office has a plan to bring down the figures.
We are doing 95, 95, 95. That is, we want to test everybody that is living with HIV. We want to test at least 95% of people living with HIV. We want them to know their status, because we have people in the community, they don't know their status. And then when we get this figure, we want to put at least 95% of this number, people who tested positive, onto antiretroviral. And then those we put on antiretroviral want to see at least 95% having viral suppression.
Today, there's quite a number of HIV ambassadors and many more who are not living in the shadows, free to declare their status and live to their fullest potential. But it wasn't always so. There were a few who braced the odds and paved the way. Meet Gifty Tokonu, one of Ghana's foremost ambassadors of HIV.
Our then president wanted someone to disclose to the public for people to know that if you have HIV, you don't look that sick that people think. Everybody refused. And I don't know, I was just carried from the chair and I moved to the podium and I spoke. And I finished doing it before I realized that I did something. So when I did, somebody was among the crowd, spotted me. And they came to me and said, when asked of my name, I mentioned my name, you'll be a good material.
It's been almost 2 decades of a life dedicated to the fighting of a virus, a culture, and stigma. But Gifty has had her fair share of rejection, exploitation, and pain.
You know, in the Catholic Church, we say the Lord's Prayer. You have to forgive somebody. You share peace before you go for communion. I realize that when I want to shake hands with some people, they do share. I like hugging. Some people will hug me halfway. Some people will pretend as if they did not see me coming to hug them. I started studying them because I knew what is coming, what I will face them. So one Friday, I went to evening mass, and I was going for communion. I realized everybody was running fast to go for communion before me. This is too much.
Gifty's advocacy has focused largely on workplace discrimination and policy. She wants employers to adhere to the laws or face the consequence.
People are losing their job because of HIV. Even to the extent that some people I don't expect, like some of the health personnel that I don't expect to do this, they go in to pay people to take care of their children, and they take advantage of the mates, take their blood sample, and when they know that they are positive, they lay them off. It is happening every day, but nobody is talking about it. And I don't know whether the law is there, but you know, due to stigma and discrimination, or fear of being discriminated against, they keep it to themselves.
Meanwhile, Faustina has had great support from the staff of the facility she works at.
With the team I work with, in fact, for them, they are so good. They are stigma-free. From the one I started working with them, the people I started with, although some of them are still not around, but some are still around, up to date, I've never faced stigma from any of them.
The religious fanaticism that has affected the campaign It's not just at the Christian front. There have been misconceptions by some Muslims and clerics that may have been inimical to the fight. Sheikh Shaibu Arimeyao, a spokesperson for the National Chief Imam.
I'm not able to remember within the Muslim community, but at least for one that may not be very popular, Yahya Jammeh, for example, was claimed that he has found a cure. But I also believe that prayers is potent enough to be able to deal with such matters of sickness. Cannot stick to prayer alone, and that's why God himself also provides medication. So not all medications are spiritual. So diseases that are physical, we will go through the scientific way to provide medication. And Islam accepts that, and the Prophet said that please seek medication, for the Prophet himself also sought medication.
Dr. Ejagu Poku believes religious leaders can be great instruments in this campaign one more time.
They must come back. They were very good. They were helpful. In fact, we have what is called care and support. That is in their domain. If somebody is positive and the person is down, the very people we fall on are the religious people, and we still do. But in terms of talking about it, we want them to do more. That when they mount the pulpit, they should be able to talk about it. Spend just about a minute to talk about HIV. They used to do that. In the early 90s, they were the core group of people who were spreading the good news.
The latest report by the AIDS Commission, which revealed that 23,000 people have been infected by the virus for the first half of 2022 alone, has sent shivers down the spine of stakeholders.
If almost 24,000 people, or 23,500 people tested in the first half of the year, is good news. We want to see that more people test. And if by the end of the year, 50,000 or 60,000 people who tested for HIV tested positive, it will show quite clearly that we are picking the cases.
The WHO thinks that if we're able to go by this 95, 95, 95, they hope that by 2030, HIV will be a thing of the past. It will be like any other condition. We want people to be aware that the virus is still around and it's still as potent as it used to be. Many people are dying of HIV. Many people are being rendered helpless. They can't work because of their condition. People should also be aware that you can't just get HIV easily. It is difficult getting HIV. It's not like tuberculosis. When somebody coughs on you, you get it. Here you must make a move. And therefore there's the need to monitor the activity to make sure that we don't contract the infection.
COVID-19 is said to have played a key role. How so?
The experience of the last 2 years clearly shows that COVID-19 is reversing the gains made from 4 decades of HIV response. COVID-19 has disrupted HIV testing, prevention and treatment services in Ghana.
COVID, like HIV, affected every country in this world. And it had its unique features and impact. And one of the impact was much felt in the area of supply chain. And as you know, HIV, as a country, we depend on imports of HIV commodities, antiretroviral medicines, test kits, reagents, and other laboratory supplies. They are all not manufactured here.
But all the stakeholders agree that one thing must happen. Education must intensify.
What we need now is behavior change. And behavior change should not be based on awareness strategies. It should be based on strategic communication.
The media should take HIV campaign as one of their social responsibilities and talk about it. People who sit in the console, every morning show, they should have 1 or 2 messages for people on HIV. And if you do that, If you have over 40 radio stations in Kumasi, you can see how we can fill the environment, the airway with HIV messages.
This is at the heart of reaching the goal set by the UN on HIV/AIDS. As the global fund support declines, the government must step up the plate and fill the gap. That is why the Director General is passionately pushing for the operationalization of the HIV/AIDS Fund.
The proposal which the Commission is advocating with our private sector partners and religious bodies and citizens of this country is that HIV should be considered one of the priorities for corporate social responsibility of companies. And we are in discussion with the various chambers. We are going to do that advocacy, and we have started with the Chamber of Telecommunications, for example. And so if that priority is given to HIV and they allocate, let's say 5% or 10% of their corporate social responsibility annual budget to AIDS, that will give us some funding that will be more reliable, and you can always plan with it.
Meanwhile, the role of NGOs cannot be underestimated in this collective fight. Dr. Henry Nagai is head of GSI and works as chief of party strengthening the Care Continuum Project, a USAID program.
We have a lot of work that is going on in the regions, the districts and sub-districts. We have been able to extend the number of treatment sites across all the districts in collaboration with the Ghana AIDS Commission, National AIDS Control Program, and various actors. The Care Continuum Project, for example, have been given the permission, and we are working in Western Region, Western North, and Ahafo Region, increasing treatment access. We are also building capacity of healthcare workers to focus on improving HIV quality of care.
For him, Ghana must position itself to be early adopters of new and improved technology and medication to boost the campaign.
Unfortunately, sometimes Ghana, we are slow we are not early adopters of new breakthrough interventions, but we do our best. We have the long-acting cabotegravir, that is the injection that you can have 3 monthly, depending on the protocol, for you to avoid, getting HIV, basically. These are areas where discussions can be held, and the country can look at how to be able to adopt this.
It's been 20 years since the Ghana AIDS Commission was set up by law in a renewed fight against the epidemic. The Global Fund and other international donors provided the fuel for this campaign. But the dynamics has now changed, and government is expected to cough up to sustain the fight. President Akufo-Addo says his government will not relent.
We cannot afford to see the significant gains achieved in the HIV and AIDS response reversed. We have the knowledge, tools, and the partnerships to end AIDS, and government is fully committed to ending AIDS by 2030.
The operationalization of the AIDS Fund is expected to be a major game changer going forward. The Director General of the Commission says a lot of work has been done to get it running.
We are now working with Cabinet Secretariat to have it approved by Cabinet, and then it will be launched, the fund will be launched, and we will come to the Ghanaian public. We announced to the Ghanaian public the accounts and the short codes that they can use to donate funds donate to the fund.
That, together with a raft of strategic measures, is being implemented to achieve the targets set, especially epidemic control by 2030.
This decade is dedicated to elimination of AIDS. Is dedicated to zero new infections, zero AIDS deaths. Is dedicated to epidemic control. If we miss this decade, we don't know what will happen.
While all these are important, a very essential ingredient that can propel the campaign or roll back the gains is your participation and posture. It is in the light of this that we say,
stop the stigma.
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 Stigma kills both the body and the soul.
Stop the stigma. Stigma kills.